The AIDS Care Group was incorporated in 1998 as a dedicated HIV/AIDS medical provider to serve the needs of an outcast group of people living in Chester, Pennsylvania, who were unable to access care and social services. We are now among the largest and most comprehensive publicly funded AIDS service organizations in Southeastern Pennsylvania. We have 68 employees and 3 offices in Chester, Sharon Hill, and Reading, where we offer an integrated model of care. The mission of the AIDS Care Group is to provide the highest quality and most cost-effective HIV/AIDS-related healthcare and social services. Our philosophy is guided by our commitment to compassionate care, which allows us to remove economic barriers, knowing that many of our patients do not have the funds to purchase the services that we provide. We embrace the public health commitment to provide care with dignity and with respect for the human rights of each of our clients. Our objective is to ensure that those in need have full knowledge of and access to our services. We provide primary medical care, HIV/AIDS care, infectious disease management, women's health care, psychiatry, psychological counseling, nutritional counseling, oral health care, substance abuse counseling, HIV testing, Suboxone therapy, and hepatitis C treatment. The agency has a state-licensed pharmacy, and its staff provides additional medication management. Supportive services include the availability of on-site case management, housing counseling, transportation assistance, food assistance, and care outreach programs. Food service is provided daily in the medical offices for breakfast and lunch, and we provide short-term and long-term housing through our rental housing units. The AIDS Care Group is funded primarily by government grants and support and from net revenue derived from our 340B program and pharmacy activities. The agency is funded by Ryan White programs, including Part A, Part B, Part C, and Part D. We have contracts with the state of Pennsylvania and the CDC, which identify the agency as a provider for Pennsylvania's CDC-funded HIV prevention programs and as a state STD testing and treatment provider. We have HOPWA funding and CIMIP with Widener University, as well as program income. During the last 5 years, the agency has been a CDC grantee to help find, test, and link disenfranchised populations living with or at risk for HIV/AIDS, hepatitis, and STDs with diagnostic programs, clinical care, and supportive social service programs. The agency was also a multiple SPINS grantee with 2 concurrent 5-year projects. One program was designed to improve access and retention in care for people living with HIV/AIDS who needed oral health care services. The other was to provide care for people who were recently incarcerated and needed reintegration services. The AIDS Care Group serves the southeastern region of Pennsylvania, where the majority of the state's 35,000 residents infected with HIV/AIDS live. Philadelphia County has the highest prevalence of HIV/AIDS in the state, with 17,809 people infected. And Delaware County has the 3rd highest prevalence of HIV/AIDS in the state, with 1,674 infected. Of the 1,674 residents infected, 1,164 live in the city of Chester. Chester is the poster child for the communities we serve, where poverty and poor accessibility to basic services dominate the social context. Chester rates as the 3rd poorest city of its size in the nation. It has been identified in the Philadelphia Inquirer as a supermarket desert where good nutrition is challenging. 36% of the residents live below the federal poverty level. Many are too poor to own cars, and only 2 bus routes run throughout the city. Chester is considered to be a medically and dentally underserved area, as designated by the Public Health Service. Chester Upland schools have continued to be ranked lowest of all 501 school districts in Pennsylvania, even though the court seized control of the district and initiated privatization over 10 years ago. In 2012, Chester was described as the 2nd most dangerous city in the United States. In 2014, there were 40 homicides in Delaware County, 30 of which took place in the city of Chester. Incarceration rates are high, heroin use is on the rise, there's a lack of safe and affordable housing, and there are a high number of uninsured residents. 3% of Chester residents are living with HIV/AIDS. Of the 979 clinical patients reported under care by the AIDS Care Group in 2014, 60% of them are male, 39% are female, and 1 is transgender. 53% of our patients are Black, 39% are white, and 12% are Latino. 93% of our patients are older than 24. 91.5% of our patients live below 100% of the federal poverty line, and 4.5% of our patients live below 101 to 200% of the federal poverty line. 56% of our patients were uninsured at some point during the year, and 50% of our patients have diagnosed mental health or substance abuse issues. Transmission risk factors are as follows: 17% are MSM, 47% are heterosexual, 32% are injection drug users, and one of our patients was infected at birth. Our patients have a high rate of incarceration and a high instance of domestic violence. The number of women seeking HIV care has remained consistently high for the AIDS care group, averaging 41% in 2009 to 2014. And the number of abnormal pap smears exceeds 64% of all women tested. The capacity to serve a large cohort of patients living with or affected by HIV/AIDS is nourished from three main factors: the accumulated strength of the agency derived from clinical and social services, the collaborative linkages that have been made over 17 years to support outreach and testing, link clients to care, and create an environment where barriers to care are removed and clients are found to have no HIV health-related disparities, and the potential to increase capacity for new patients derived from program income due to clinical billing and the utilization of the 340B OPA discount drug pricing program. To sustain growth of new patients, we have tied together clinical care, pharmacy services, and the ACA insurance changes, as well as identified infrastructure development and system improvements to better access, track, and keep patients in appropriate health insurance products with adequate formularies. The AIDS Care Group is actively working to grow its clinical programs with an emphasis on HIV, hepatitis C, and STDs. Additionally, we are developing outreach programs with the new HIV testing venues funded through the CDC, and we are also partnering with county jails to refer patients into care. We are developing contract pharmacy programs under 340B with Ryan White agencies, disproportionate share hospitals, and FQHC programs. We are expanding our own retail pharmacy and 340B services, and expanding our capacity for on-site treatment of hepatitis C and STD programs at all of our locations. We are integrating primary care into mental illness and substance abuse programs, and we are expanding our primary care facilities. The AIDS Care Group will continue to follow our mission and work tirelessly to respond to the unmet needs of our clients.